Hi, this is Kristen Digwood from Elite Pelvic Rehab, and I'm still focused on talking about the pediatric population. We discussed how constipation impacts children and can cause bedwetting, urinary, and fecal accidents. Typically, the second most common cause, and it's sometimes in conjunction with constipation, is a chronic holding. Children do not like to stop what they're doing to use the bathroom. They would rather play, they would rather be with their friends. It's just not something they want to go do. And they get very good at shutting down that signal and not going. Unfortunately, this has negative consequences in the urinary system. It causes a tug of war between the sphincter and the bladder. It can cause them not to have strong signals on when they need to go, and it sets them up for bedwetting and accidents down the line. We generally have children put on a timed voiding schedule if this is an issue. So we may have them set a watch for every 2 hours. We may have parents do that and just have them go into the bathroom to void. When they do go in, though, it's very important that they don't just rush this. Sometimes when we tell children they have to go, they're in the middle of something fun, they rush in, they don't fully go, they rush back out. Sometimes we'll even have a timer in the bathroom. We'll make them be in there for 5 minutes. We may make it a game. There's a whole variety of things you can do with that, from putting Cheerios in the bowl to having to do a puzzle when they're on the toilet, to make it a little bit more of a fun experience for children. Over time, this should correct the problem that they may have created within the bladder and the sphincter system. But again, with children, healing takes a little bit longer, so it's something that you have to remain very consistent at. By doing this for a week, for instance, you may not see a whole lot of progress, but by sticking with it for 2 months, 3 months, you should see things turn around a little bit in this, and you can utilize this technique while you're working on constipation, or if constipation isn't an issue, you can just attack this one directly on its own.